of the coin here, both sides of the aisle, two representatives joining us from D.C., one of whom has actually come up with a kind of a Rube Goldberg chart of what this new health care bureaucracy might look like. He is Representative Kevin Brady. He's a Republican of Texas. And also with us is Representative Jan Schakowsky. She is a Democrat of Illinois. Good to see you both, Congressman. Thank you for being with us. Appreciate it.
Thank you.
Now, Kevin Brady, let me go to you first, because congratulations for coming up with this. And just to be sure, this is not all make-work, Congressman. You've actually done a little bit of research and found out which various bureaucracies and bureaus and offices are going to be needed in order to make this new health care system work, right?
Yeah, it's very accurate. The public wanted to know how will all this work. So our Joint Economic Committee took the Democrat bill, provision by provision, and just identified every new federal agency, mandate, commission. There's 31 new of them, by the way, all of which come in between you and your doctor. And the question when you look at is, what patient in their right mind would choose to have the government interfere to this degree? All
right, well, let's just look at some of these just to make sure that folks out there realize this is a real thing. This kind of represents, this incredible flow chart, remember Rube Goldberg, kind of represents what we're going to get ourselves into. I'm just going to pick out a couple, Congressman Brady, and get you to explain. First of all, we have this thing here. It's called the National Coordinator for Health IT. I guess that's information technology, right?
Yeah, that's one of the new agencies.
So that's an agency that, you're going to have to spend taxpayer money on. You're going to have to hire a whole bunch of bureaucrats. All the bureaucrats are going to need secretaries and a whole staff, right?
Yeah, and David, if you look at that chart, there's two real key components. In the bottom of the center, there's a blue box that says the Health Choices Administration.
That's right here. Health Choices Administrator.
Yeah.
Yep, we got it.
That's the new health care czar. That's the person who's going to be picking winners and losers in healthcare, and most of the chart flows to that person in that agency, and the end result is they're going to tell us what doctors we can see, what treatments we deserve, and what types of medicines we can receive. That's what most of this chart is designed to do. Pick winners and losers.
All right, but Congressman Brady, you're from Texas. I'm from Washington, D.C. I grew up in Washington, D.C., so I know how these bureaucracies work. I've walked through the hallways, and it's the little agencies that interest me. I mean, here you have something called Physician Quality Reporting Initiative right here. It's these little agencies that grow up like wildfire. That's where the taxpayer gets nickel and dime to death,
Oh, you are so right. That's the new regulatory structure that they say by adding new red tape and regulation will lower health care costs. Doesn't work. And just above that is another one of your little agencies, the Comparative Effectiveness Research Group. They're the ones that are doing the rationing. They're going to determine whether you're too ill, too sick to receive this government health care. So you're right, the details are in those smaller agencies.
Well, and then, one agency has to conform with all the other agencies that have preceded it. And remember all the civil rights legislation and all of the linguistic legislation we've had. Here's a little box here. It's called the Cultural and Linguistic Competence Training. So all these new physicians are going to have the same linguistic competence in order to deal with folks that don't speak English that all the other federal agencies are going to have.
Yes, and they're telling us that if we'll just adopt all of this government red tape and this just bureaucratic mess, that our health care will be higher quality and cost less. And just any small review of that chart tells you differently.
All right. Now, Congresswoman Schakowsky has been very patient standing by. I know you've had to go through this flow chart. You've seen it. You've got a flow chart of your own. Go ahead and tell us about it.
Well, actually, it's a big question mark of what the Republican plan is, but here's what I want to say.
We put it up, by the way, we put it up on the screen, Congresswoman, just so that you know. Now, obviously, this is not representative, but it shows you that there are a lot of questions about what the Republicans want to provide, right?
But let me even take this chart seriously, because I think the counter is that between consumers and their health care providers right now in this country stand a very big obstacle, and that's called the insurance companies. And if you like the way they've been doing it, you get to keep it. But if you don't, and under the regime of the insurance companies right now, what we have is live sicker, die younger, and pay twice as much. That's the health care system that we have right now. And of course we're not going into all of these bureaucracies. This is a much more accurate chart of what we currently, the consumers have to navigate right now. We want to say to all American consumers, no longer will you be denied health care because you have a pre-existing condition. You will not go broke. You won't go into bankruptcy because of health care costs any longer. There will be caps on how much you have to pay out of pocket. This is going to affect not only low-income people who can't afford health insurance. We're talking about middle-class people. 52% of Americans were not able to afford all the health care that they needed last year.
But Congresswoman, the question I want to know, before we go to this, and I'm pointing right now to this huge flow chart that your representative is
totally ridiculous.
Well, it's not ridiculous. These are real organizations within the federal government. They actually do represent real agencies.
No, they're not. You talk about initiatives. Well, there are a million different initiatives right now.
Congressman Brady, did you make all this up, Congressman Brady?
No, our staff went provision by provision through the Democrat bill in the House. It was developed by 3 committees. So it was pretty easy, actually. We spent a lot of hours to just lay it out. But the point is, if you love the bureaucracy of Medicaid, if you love the bureaucracy of Medicare, they've just made it worse. Most Americans don't want that.
It's the bureaucracy that's the problem, Congresswoman Schakowsky. It's the question of whether we are getting into a bureaucracy, the likes of which we want to get out of with Medicare.
No. People, if you like what you have, you can keep it. You don't need to go to anything else. But if you don't, and I have yet to really find people who love insurance companies, and if you aren't getting what you need, you will have a choice, a real choice as consumers. You can choose a public plan. You can pick another insurance plan. If you need help in paying for those premiums, you may be able to get help from the government. You pick your own doctor. What is the representative talking
Brady,
about?
what's wrong with that?
Tell you what doctor you have to go to.
Congressman Brady, what's wrong with that?
It's a fiction. The truth of the matter is this whole thing's designed to force people into a government-run plan over time, a plan that, like Medicare and Medicaid, is already bankrupt, where you don't have a choice of doctors,
they're not
where you don't have
bankrupt.
a primary phisian, and absolutely they are, and you can't disagree with that. The point of the matter is, do we want government to tell us what doctors we can see, what type of treatments we get, and are we going to ration health care at the end of the day? We're already seeing it in the government programs.
Well, hold on a second, because Congresswoman, it was just a couple of years ago that we were being told that Medicare and Medicaid were running out of money, that they're bankrupting the system, that they're far worse than any problem that Social Security has, that there's $50 billion a year in waste and fraud. You deny that those facts are true?
You need to talk, all of you need to talk to senior citizens, people over 65, and persons with disabilities. Medicare is a system that has been more efficient than almost any other system, way more.
Do you deny that there's $50 billion a year in waste and fraud?
Of course there is.
I would say that no, but wait a minute. It's 6%, about 6% overhead for Medicare, and about 25–30% overhead and waste, money that doesn't go to health care.
All right, Congressman. The fact is, Congressman Brady, if we multiply that $50 billion of waste and fraud from Medicare 2 or 3 or 4 times whatever this is going to cost, what's that going to bring us in terms of waste and fraud?
Another bankrupt government program we can't pay for and doesn't deliver quality services. We've run this play before as a country. We know how it ends up. We just don't want to start it. We want people to keep their own plan. We want the government plan out of this.
Oh, you want status quo. He wants status quo? That's just
great.
Absolutely
not. In fact, I'll tell you what the difference is, David. is that we want to cover the uninsured, all of them, by helping small businesses cover theirs. That's the bulk of the uninsured. By helping people who are in between jobs, another big bulk of it. We also want to provide the incentives so people can have more choices, because right now they're locked in, and we want to knock out that fraud and abuse that's in the government
and Congresswoman,
plans.
I
We
gotta
want
ask,
it out of the
are
private
you sure
plans.
that before we have to go to a big collective government system or a government-run insurance company,
This is
that
now